Welcome back, viewers, for yet another corporate interviews of Winning Business. Today we have with us Dr. Anjali Chhabria, a very well-renowned psychiatrist, and today she's going to take us through the journey of how she's progressed into this profession, which is rather dynamic at today's day and age. And she's going to speak to us about her progress and her challenges and her vision. Let's hear it from her. So, Doc, can you share about your journey in the field of psychotherapy?
I decided to become a psychiatrist in 1985. And at that time, people thought that, some people even think that today, that only mad people go to a psychiatrist. So people were so shocked at my decision that there were doctors who were convincing me that no, please don't take up this profession. How are you, being a lady, control someone who gets violent in front of you? There were other people who actually went and told my parents that nobody will get married to her. So please tell her to change her mind. But thankfully my parents were quite supportive, and this is something that I loved. I just thought it was so interesting that why is it that some people behave in a particular manner and there are those who behave differently. So I was really intrigued by it, and I'm thankful for my parents to support me, that they let me do what I wanted to do, and that's how I started 33 years before. And I think mental health, the way it has changed, today India is, WHO has said that depression is the biggest challenge in India, and I think people are more open to taking help. People are open to talking about it. People bring their child for help. But of course, this journey has gone on from, people saying that, what are you doing? To now people saying, oh wow, you're doing something. Today you're here because, people recognize that the need of a psychiatrist in India.
So, ma'am, the whole market, if you look at it as a market, has really progressed, or rather become very dynamic, given that the city life is very stressful, a lot of competition. So what is the scale or you can say need for psychotherapy in the Indian market, and how do you look at this as a market?
So, for example, earlier what people thought is that, I look at it as, say, doctors and lawyers are professionals. Okay, today it's all right, when people go to a lawyer, you're ready to pay him a fee. But unfortunately, doctors are viewed differently. Doctors are supposed to do work free of cost and even not even charge for their service. But I think India is slowly changing. People are open to paying for services, and when they see benefit in services, they will definitely pay you for it. So if you are looking at the financial market, definitely if someone is passionate about what they do, there are people willing to value your work. If you are looking at numbers, when you're looking at a market, you're also looking at numbers.
Yes.
The need for psychiatrists, for psychotherapy is so high, because today our youth is exposed to everything that's happening in the world. So they think that if someone can go and meet a psychotherapist in America, then why not in India?
True.
And there are only around 5,000 psychiatrists in the entire country.
Okay.
So there is so much work to be done.
So as an expert doc for about 30 or 33 years, can we put a number to the industry? If I say this as an industry, a large industry, like how different industries are viewed, even in the field of medicine. So can we put a number to this industry in terms of rupees? What is the market size?
See, I wouldn't understand the number in terms of monies,
okay,
but definitely there's a lot of need.
So if you look at a percentage, if you give a percentage to the population, we have 1.25 billion population.
So today depression is the number 2 disease in India.
Okay.
And it will soon become number 1.
Okay.
Okay, that means 1 out of 4 people who walk into a doctor's clinic, who walk into a general practitioner's clinic, is suffering from depression. So if you look at that, it's a huge number, and there are hardly any doctors, there to treat them. So because of that, there is a huge market, in terms of, it's like, imagine there is one doctor. If you're talking about 5,000 psychiatrists in entire India, so there's probably one doctor for what, a lakh of population, or maybe 10 lakhs, I don't know.
That's very less.
That's really less. So there are a lot of people who need our help. But of course, awareness needs to be created.
Okay.
And that is something that we've also been working on for the last 25-30 years.
Of creating awareness.
Yes.
Apart from depression, as you mentioned, it could be probably the number one issue.
Yes.
What are the other mental issues you think are affecting our society at large?
So the thing is, anxiety disorders, very, very high. Schizophrenia, drugs, alcohol, our geriatric population is increasing. So we have a lot of senior citizens today who need help. Children today, parenting itself has become such a tough job, and parents don't know how to bring up their children. Now our youngsters today, we have the highest number of suicides in our country. Every 1 hour there is a person who kills themselves, and most of them are youngsters. So every day there are 16 youngsters who kill themselves in India. Okay. It's alarming. It's almost as if there's an epidemic of suicide going on in our country. And so what happens to all these people? They need to be seen, they need to be treated. And the reason for that is that there's a mismatch, because today, our children can see anything which is happening in the world thanks to technology. But they do not even have counselors in schools. Not all schools have counselors. Parents don't even know that they should take a child for counseling. So because of that, there's a huge amount of work that we need to do in India today.
You have also used various platforms to speak about such issues like depression, suicide, child abuse. You also written a book, I believe. And so what is your vision and hope for these things? So because you said there is a huge need, and there is a possibility of good scaling up of this opportunity. So what is your vision?
So I would want probably a psychiatrist 1 in 100 or 1 in 1,000 at least. Plus when we're talking about psychiatry, it's not necessary that everybody has to become a doctor and do psychiatry. We need mental health professionals. We need mental health soldiers. And that is why with my book, which is called Death is Not the Answer, I've been going to various schools, colleges, universities. I've been addressing doctors. The book released, I think, around 16-17 months ago. Okay, and once a week since then, I continue to have a talk at any organization, telling people about mental health, creating an awareness and educating them as to how anyone should get the help and anyone can get the help that they need. So one has to recognize the signs and symptoms of a problem and take help for it fast. One should not wait for it to become a big problem and then address it.
Just to simplify this question further, so how many clinics you operate now, ma'am? And given the demographic need in our country, how many clinics you would go further?
So I only operate out of one place. Okay, but what I'm trying to do is I'm trying to create awareness. And it is not necessary that people only have to come and see me. They can go and see any doctor. So they can go to any psychiatrist in their vicinity. They can go to a family doctor. They can go and talk. The thing is, we need to talk about mental health issues. So I try and address whatever platforms I get, but it is not for my benefit. It is for the benefit of the country.
So can you briefly tell us about your team at Mind Temple?
So at Mind Temple, I'm the only psychiatrist, but we have psychologists, we have counselors, Okay, and we have other therapists who come in. So we have hypnotherapy, for example. So we have all the kinds of therapies which are prevalent right over here. Along with that, what we try and do is we try and use age-old techniques. Like suppose we have yoga, we have music. Along with the newer treatments, we try and get whatever new treatments that come into the world, we try and bring them at Mind Temple, so that people, earlier people would come and say, oh, where can I go in the world to get this problem treated? I don't want anyone to go anywhere in the world. I want all the treatments to come here, so that people don't need to travel anywhere. But we can do the treatments in India itself. So we have the latest technologies for depression, for anxiety, even for children. Children have disorders like attention deficit disorders, and we have the latest treatments which can be done in India itself.
So typically, if we can say, for the benefit of the viewers, there are different issues. Like if we look at depression as an issue, so a patient walks into your clinic, so what happens?
So if somebody walks into our clinic, okay, and the first thing is a detailed history is taken, okay, to find out, because see, depression is a very lay word, but you are different from someone else. So if you walk into the clinic, somebody is going to first talk to you and understand why you're here, what is your need, whether you wanted to come here or whether somebody's brought you here. So a detailed history is taken. Once a detailed history is taken, then I see the person, and then we come up with a diagnostic formulation. That means what is the person suffering from and how do we intend to treat the person. And then an entire army of people get in to treat the person. So for example, if it's a youngster coming saying, I'm very depressed, we need to find out why, what, how, whether there is a stress coming from the parents or from the school. So in that case, we also need to counsel the parents, and so we need to treat the youngster, we need to talk to the parents, then we need to formulate what is the right fit for this person. There can be an engineer who's really unhappy with his job. Does he want to continue being unhappy, or does he want to do something else? Now we have psychological assessments which also help us to then say that, okay, this person's creativity is very high, so maybe he should look for something which is where he's more creatively challenged. So we kind of help the person, help the family. Sometimes people are just a symptom of what could be happening in the family. So we help them in that way also. So there are some tests which a person may need to do, and then we may also need a little bit of medication. Now also in India there's a huge fear of taking psychiatric medication. But taking medicine for disorders is if you have malaria, you will take a tablet. But if you are depressed, you say, no, I don't want to take a tablet. So that's how high the stigma is in our country.
Okay.
So it's not that one cap fits all. We have to work with the family to find out, and we have to have a path. And then I tell people that, maybe it'll take us 2 or 3 months to make you all right. And then we have sessions with people, with their families, and slowly you see that depression or any other disorder is a thing of the past.
Have you seen any change in the stigma? Yes.
Definitely. Earlier, in fact, as I told you earlier, the people were so scared. They said, oh, we've heard that psychiatrists also become mad after 15-20 years. So that whole stigma of only mad people visit psychiatrists has slowly changed. Of course, we worked very hard for it. So now, earlier there were no counselors in schools. Now a lot of schools have counselors. People even bring a little child and say, oh, this child is getting headaches or complaining of, not wanting to go to school. Do you think it's a psychological problem? And other doctors also were so reluctant to refer cases because they would say, no, the patient will run away if we tell him that you go to a psychiatrist. But definitely this has changed, and people are more accepting. There may be a little reluctance, but I think in a day, at least there are 2 or 3 people who come themselves and saying that, I'm getting very stressed or I'm not able to sleep. So do you think there could be some psychological problem that I'm suffering from?
What is the role technology plays in this treatment? How much percentage wise, or what are the new things technologically there are advancements?
So we have today, we have certain assessments, which can be done. And again, today we can reach out to the entire world. Thanks to technology. So, because of the distance, so there are people, as you asked me that why don't, do you want to have centers all over the world? I don't need to. I can sit here and communicate with whoever I want in the world. So similarly, my counselors also have, I think 1/3 of their work is having online sessions. So there could be a student in America who is communicating and having sessions with one of the counselors, because what happens is culture and psychiatry go hand in hand. Today an Indian kid in America is more comfortable talking to an Indian psychiatrist or an Indian counselor, because he understands that an American counselor may have a different role to play. He may talk to him, but the cultural context is different. So that way, thanks to technology, we can reach the world. Then we have tests, which today, if maybe 10 years back, people had to sit in my clinic and do it. Today, thanks to technology, I just have to send them the test. They send it back to me, and we have the report generated. We also have newer treatments, which can be done. We do something which is called as a magnetic treatment, which is a pretty new treatment, and that's called RTMS, TDCS. So these are some of the newer treatments which have come into existence also because of technology.
And what is the speed of recovery because of the technology?
See, definitely earlier people would probably be on psychiatric, and maybe because of that the stigma came, be on medicines for years together. Today, because of the latest treatments, and so we've tried to cut down. So there are people who may get well in less than 3 months.
That's nice.
Yeah. So you don't have to keep taking medicines. The medicines are newer. So there are tablets which are there. Maybe you need to take 1 tablet once a week. We have injections once a month. That's it. So imagine taking 1 injection a month and you're all right. So there are a lot of new techniques which have come up.
Very interesting. So, is there any measurables to evaluate patients' improvement? And
yes. So we have tests which can also, we have rating scales. So someone is suffering from anxiety or depression, we give them certain rating scales. So you can see for yourself that when you came here, you suppose you were scoring a 30 on 40. Today you're scoring 20, and then you're scoring 10. So definitely as you feel better, the rating scales help you to have an objective evaluation of yourself.
Interesting. So, Doc, just a little personal. How do you keep yourself motivated when you have, when you are catering to so many patients day in and day out?
No, see, I love what I do. I won't trade it for anything else. So I think when you're passionate about what you do, you're not working. You're just enjoying yourself. So I really believe that.
And Doc, what's your expansion plans for Mind Temple?
So I think right now what happens is, I think expansion takes place every day. When you have a new technique that comes in, when you have someone who's come in with some experience. So all my psychologists we have wonderful people working with us. So because of that, I think we are expanding every day, and we are reaching out to more and more people all over the world. So I don't have any plan as such. I think we've just been, growing, and of course I have written 1 book. I'm still taking the book to all the places. Recently I did a TEDx talk, which was about the same subject, and a lot of people have contacted me. We are trying to now do workshops with a lot of schools. So there is one workshop which we are doing where we are going to be catering to 5,000 kids, underprivileged kids. So people are coming forward, and we are there, we are wanting to help the world, you know. I've recently even been appointed as a convener by the Indian Psychiatric Society, you know, for public awareness. And I think creating awareness about mental health is something that I will continue doing.
It's a key driver. And what is the last question actually, Doc? What is the legacy you would like to leave behind to the society?
I want to leave a legacy, but I just want to leave my viewers with the thought that emotional health is as important as physical health, perhaps more important. Because if you don't feel good, you know, if mentally you're not there, physically you're not there.
True.
So I think I would just like to leave my viewers with the thought that, you know, you can do better and anyone can do with a little help. Even if you're doing well in life, I have two types of people who come to see me. One who has a disorder, and there are some people who will come and say, you know, I want more out of life, and we figure a way out. You know, so anyone can deal with help where emotional health is concerned, and I think we should not shy away from taking it.
Thank you so much, Doc, for your time.